So welcome everyone to this webinar put on by the Rural Ontario Institute. Today we're looking at well-being and vital signs reporting. We've been working with communities over the past year or so who are doing vital signs reporting or community well-being reporting and trying to look at and capture stories that highlight how communities are leveraging data to mobilize community action. So moving from the report writing process into the community engagement and community action part of things, where they start to implement some of the ideas that they've uncovered through their data gathering. Throughout this initiative, we worked alongside 3 community partners, and Nadine, Devin is the early years project manager with the County of Middlesex. And each of these community partners have been documenting their activities as they've gone along. They'll be producing a short written case study, and they've agreed to participate in these webinars for more of an interactive kind of knowledge transfer. So it's our intent at ROI to share some of the stories and lessons learned from this so that other communities may borrow some of those ideas for their own initiatives and hopefully move the bar forward in their own communities. So without further ado, I'll invite Nadine to start sharing her screen and to take over the webinar for now. And she's going to present for about 30 to 40 minutes, and following that we'll have time for some questions. But as I mentioned, please feel free to chime in the chat window with your questions, and I'll help moderate that as we go along. Over to you, Nadine.
Okay, thank you, Ryan. So thanks. I just want to start by saying thank you to Ryan and Rural Ontario Institute for the funding through the Community Demonstration Project, as well as this opportunity to present on our multi-sectorial collective impact project. So as Ryan mentioned, I work for Middlesex County. I am a project manager, early years project manager. I have the luxury of working with an array of great community partners as part of this project. So my role is to act as the overall lead of the project, acting as the backbone support in terms of all the various working groups that are involved in the project. So this is just an overview of what I'm going to present today. So I'll start off with a little bit of background about Middlesex County and how our project got started. And then I'm going to provide some highlights of our story. I'm going to start with information about, it says LAP event, it should say launch event, then how that launch event helped to build momentum in our community. I'll share some highlights of our community engagement process and how we use data to understand local issues. Share some highlights on how we came to our common vision and co-created action plan, and talk about where we are now in terms of moving to action and how we're engaging our partners in implementation, as well as some next steps. And then I'm just going to end with some lessons learned through our process and strategies that I would recommend to propel action in your community. Okay, so who are we? Who is Middlesex County? So we're a large rural community in the heart of southwestern Ontario. As you can see in this picture, we wrap like a horseshoe around the city of London. We are home to 8 municipalities. So our total area is just over 2,800 square kilometers, and we have a population of just under 72,000. All right, so the work I'm here to present today really started with as a result of an opportunity. So just a bit of background. For over 2 years, our community was one of 40 communities in the province involved in the Healthy Kids Community Challenge, which was a cross-sectorial collaborative project. This project encouraged communities to organize programs, various projects to support healthier behaviors among children. This project was a huge success in Middlesex County. We had a lot of great programs and policies, and we helped to foster healthier environments in support of healthier children. This project also, as well, had a huge impact in terms of partnerships in Middlesex County. At the end of our project, we asked our partners to provide some feedback on the partnership as a whole and what they saw as the benefits of the collaboration. And these are just some of the reported highlights that came out of our partner survey. It was found that the cross-sectorial partnership project really helped to build, reach more people and have a broader impact, helped to create new networks, improved connections between agencies, enhanced trust among our partners, and resulted in new and improved communication channels. And our partners really wanted to keep the momentum going. They really wanted to continue to explore ways to work collaboratively. So, in the months following HKCC, there was an invitation that came out from an organization called Ontario Public Health Association, an invitation for Healthy Kids Community, those 40 communities involved in the Healthy Kids Community Challenge, to participate in a new project. And this one was called Keeping Kids Healthy Through Collective Impact. So this project aimed to build on the successes that were built through the HKCC in terms of cross-sector collaboration. And in the end, the County of Middlesex was one of 4 communities who were selected to participate. Okay. So, as I mentioned, the goal of Healthy Kids was to support healthier behaviors among children and families, and really to focus on programs and policies and projects in support of that goal. Well, this particular project, the Keeping Kids Healthy Through Collective Impact project, really did have a different focus. It was more around looking at system-level changes or system-level thinking, with a particular focus on improving linkages and connections between health and social service sectors, with the goal of achieving better health outcomes for children. And the other difference with this project is communities were encouraged to use a collective impact approach. So in addition to the funding we received from OPHA, we were successful, as we're here today, in participating in the Rural Ontario Community Demonstration Project. So our story starts with a launch event back in November of 2018. So we really are fairly in our infancy, I would say, in terms of this particular project. We're just now approaching 1 year. So we started with this launch event because we wanted to re-engage all of our Healthy Kids Community Challenge partners into this new project, as well as explore ways to engage new partners that weren't necessarily involved in our HKCC work. So we had over 40 partners attend with representation from a multitude of sectors that are listed here. So we had folks from libraries, school board, primary care, childcare, etc. So it was a really great success to have 40 partners from across all sectors come out to this event and hear about this new project. That said, we all had a lot of questions going into this particular project, like what is collective impact? How is this approach similar or different than the work we've done in our community in the past? What is system level change? What is system level thinking? What is all that exactly? So we really used this launch event as an opportunity to delve into some of these concepts, collective impact concepts, system level change concepts, in order to help ensure we had a shared understanding amongst our community partners about what all this really means. So I'm not going to go into a lot of detail, but just for those that are on the call that may not be familiar with the collective impact approach, just wanted to share a few highlights, and these are some of the things we presented at our launch event back in November of last year. So collective impact starts with a common agenda. So it's coming together to collectively define a problem and create a shared vision for change, as well as some key principles using local data to help shape that agenda and to continuously use data to learn, adapt, and improve as you move along, as well as looking at initiatives that have a priority placed on equity and equitable access to whether it's services or supports or programs. So ensuring that all children or anyone within your community has equal access, as well as focus on system level thinking and system level change. So the first point around a common agenda and coming together to collectively define a problem and a shared vision to solve it was new for our community, because for Healthy Kids, the vision for change was already established. So we were had various themes that we had to work around, and all we did at this point was to look at some of the evidence around various interventions to focus around diet, helping to influence diet and physical activity behavior. So in essence, the vision for HKCC was already established. With this particular project, the exact vision for change was not established, and it was open for shaping. So this was really new for our community to embark on, as well as these other latter 2 points around equity and system level thinking and system level change was also very new for our community as well. So again, I'm not going to go into a lot of details around system level change, but just wanted to kind of give you a little bit of an overview. I would actually, if you look at the bottom of the little image there, and there's a reference to a document called Water of Systems Change, I would actually recommend reading that particular document. It was very, very helpful for me to review and helpful for our community partners to review as well, to help us understand really what system level change is all about. So according to this model, there are 6 conditions for system level change, and they're all listed here. So the document I made reference to, the water system change, it aims to clarify what it means to shift the conditions that may be holding a particular social issue in its place. So for many of us, including myself, I was very accustomed to developing and implementing programs and services and activities in order to achieve an outcome, where system thinking has you think about things differently, taking a look at some of the structures, the relationships, practices and policies that may be existing within a system that may be contributing to inequities in children and families in achieving particular outcomes. So it's not about developing more programs or more services. It's about how can we shift some of the conditions within a system that may be influencing or impacting one's ability to be able to access a particular program or access a particular service. So that was, again, some very different thinking for our community, is that we weren't embarking on more programs and more services, just looking at how we can improve connections within our existing system. So back to our launch event. We felt this launch event was very, very important for our project. As I mentioned, it helped foster a shared understanding of the project and some of these new concepts. It helped shift people's thinking from a program delivery model to system level change or system level thinking. It helped partners understand how they could support the particular project. We started to commence community engagement at this particular launch event, having people think about some local issues and some challenges within the system right from the beginning, and ultimately helped build momentum and buy-in for our next step. Okay, so second phase. So after our launch event, that's when we really delved into the project. So one requirement of our funders, the OPHA funders, was to complete a situational assessment, which was ultimately to help us understand what our local issues are, what are some of the challenges within the system, and then ultimately to submit a final report to our funders, which is depicted here. So this slide just shows you an overview of that particular phase and all the different meetings that we held over that time period, and some of the data collection or community engagement strategies we used over these few months. So starting in December of 2018, after that original launch event we had, we held a series of meetings to help us start to collect some information that we have available already and determine what other information we need to collect. So that first meeting in December was sort of a kickoff. You'll note that there wasn't a lot of participants at that particular meeting. It was a horrible snowstorm that day, so we had definitely a lot less partners involved at that particular meeting, but really it was a great start. We discussed what information we had available to us and walked away with different tasks and who would collect what. And then back in January, we collated all the information that we had available at our fingertips and presented it back to the larger group. So we reviewed some of the findings together. And then we used a system lens to determine what gaps in data that we were missing. And that is when we established that we needed more information from both service providers and caregivers on challenges that they face, specifically as it relates to communication amongst each other, connections within the system, and relationships within the system as a whole. So in terms of the service provider survey, we wanted to know more about communication between agencies and families and challenges in communication, ways to improve communication within the system. We also wanted to know more about connections within the system and ideas for improvement within those connections. We also wanted to understand more around access, availability, and affordability of services within the system and ways that we can improve equitable access. And lastly, we wanted to know more about the training needs of partner agencies in terms of applying an equity lens to program planning, to program and service planning. In terms of our interviews with caregivers with lived experiences, we wanted to know more about their sources of frustration when accessing a resource, for example, cost barriers, hours of operation, wait lists, geography or transportation issues, whether there was a lack of awareness of services, etc. We also wanted to understand who families go to for advice on services and supports in the community to support their child's health and development. And then lastly, we wanted to understand their perspective on improvements that can be made to community resources in order to support their child's development. So following these two latter engagement strategies, we compiled all of the information from our initial data collection around local issues and challenges, and then the data that we gathered from these lived experience interviews as well as our provider survey, and put it all together into a final report to submit to our funders. So why was all of this important? Why is data collection so vital? Well, for us, it really helped us foster an understanding. Again, as I mentioned, this was all very new for us. So it really helped us foster an understanding of what are the local issues, what are some of the system challenges, and what are possible solutions or opportunities. It really helped to identify information gaps. So as I mentioned, we identified that we needed more information, and so that led us to implementing that provider survey as well as those caregiver interviews. And then ultimately, all this data collection really provided us with this aha. So it provided clarity around what is our common vision and our strategic priorities for action, which I'll go over later. Now, with that said, we often, and I'm at fault for this as well, I think we did a little bit of this in HKCC, is we tend to collect data as an individual organization in our silo, and then we share it back to our community in a report. And what I found through this particular process is that does not foster the same level of understanding or support for action. So in my experience through this collective impact approach, it's really important to really get a shared understanding of local issues and system challenges. It's important to not work in isolation and really engage partners from the beginning in the entire process. The other thing is it's very important to ensure you have multi-sectorial representation in your engagement efforts, because this helps to ensure that you're gathering and interpreting data using a variety of lenses. So it allows for you to have a more comprehensive picture of local issues and challenges. And as well, to really ensure you're broadening your lens when possible, it's important to engage with those with lived experience. Okay, I will just very briefly give you a little bit of information about what we heard through our data collection process, just so you can understand how we came to our common vision and our strategic priorities. So what we did find is access to resources and services can be a challenge to health equity in Middlesex County. So for one, compared to the City of London, the county has significantly lower availability of services and supports, as well as very limited transportation. We do not have a public transportation system in the county. So when you couple all that, when you think about there's more services and supports in the county, we do not have a public transportation system. As I showed in that original slide, we're a very vast rural area. So for some families, it can be upwards of an hour to be able to get to the City of London. And then couple that with the fact that we're about to enter into the winter season and how weather can be a challenge for people to travel. We did identify that there are a lot of great community programs and a lot of services and a lot of supports that are in place. However, we did identify that there is a need for improved coordination, as we were finding that the community is still working in silo. In terms of caregivers, when we talked to our caregivers, again, we heard that issues around services mainly focused on their access, availability, as well as a general lack of awareness around what is available. And we heard that as well from our providers. Other concerns from the caregiver interviews focused on the need for earlier diagnosis and intervention once diagnosed. In terms of communication, about 1/3 of our providers indicated they did not promote or communicate the services and supports of other agencies regularly, and about half reported only occasionally or rarely communicating with other agencies about their own services and supports. We found this to be really interesting and very regrettable, as according to our caregivers, when we interviewed them, referrals by professionals or referrals by providers was the most frequent way they heard about available and relevant resources. So these are just some of the challenges that came out in terms of what we heard from providers in terms of communication: lack of time, lack of funding, not knowing who key contacts are to direct information, a lack of understanding of who agencies are and what services they provide, keeping up to date on who to contact. So just a general lack of awareness about who is who, as well as not having the time and the funding to be able to communicate effectively on an ongoing basis. Some solutions that came out, or suggestions that came out from providers on how we can improve communication and coordination within the system involved a solution around potentially having a branding or a centralized channel for accessing information and for promoting and communicating services and supports, as well as more opportunities for facilitating connections with partners, whether it be through an open house, events, and workshops. So as part of our engagement strategy, we asked both providers and families around this concept around connectors or key connectors or community connectors. And for the purpose of this particular project, this is the definition that we use, that it's agencies who families trust to consult with, who understand the breadth of services within the system and how to facilitate connections between families and agencies. So through our process, it was identified by both our providers and the caregivers that we interviewed that our library system is considered a key connector or a trusted connector, as they act as hubs for information, supports, and services for families and service providers. So why is this important to know? Why is it important to know about who are the community connectors within the system? Well, knowing this can really help to build strong and effective linkages across the system. So it can help us to ensure that agencies across the system, across all sectors, are aware of the key connector, that Middlesex County Library is a key connector, and the role they can play in supporting families and navigating the system. It's also important because then we can increase awareness amongst families in terms of who the key connectors are, as well as help build trust between the library and the families within the system. And then lastly, it's important for us to be able to identify what are the needs of Middlesex County Library staff in terms of how can we build their capacity in acting effectively in their role as community connectors so that they can ultimately better help families navigate the system as a whole. So that was just a bit of an overview of some of what we found through our community engagement process. So the third phase was around taking all the information that we gathered through the engagement process, looking at all the data, and then sitting down together as community partners to develop a shared vision for change and a co-created action plan. So this slide just shows you some of the various steps that we took in that process. So we held a series of meetings between April and June of this year to shape our vision and strategic priorities. So in total, we had 7 meetings to be able to reach the final vision and action plan step. So the result, through this process, we were able to develop a common vision, which is listed right here on the slide, as well as 5 strategic priorities and 5 strategies for action. I'm not going to go into huge detail in terms of the aspects of the action plan, but if anybody is interested in me sharing the final action plan, I'd be happy to do so. Just pictured here are the 5 strategic priorities and the 8 strategies for action. Again, I won't read them out, but ultimately our overall goal for this particular project is to help families feel more supported in their community and to really look to implement ways to facilitate better connections between families and service providers so that families are accessing the services and supports they need in a timely fashion. All right, so we are now in the 4th phase. That is the implementation of our action plan and moving our partners forward into action. So this diagram just shows you sort of like how everybody is involved in supporting in this particular project. So you'll see the outer green section is this larger coalition or the larger network of agencies who are supporting the common agenda and the action plan, whether it's just helping with implementation of a particular project, or whether it's actually sitting on a particular working group. So it's sort of this larger network of agencies that are involved in supporting families and accessing services and support. At the center, you'll see that there's a central coordinating committee. So that has been established, and we have 7 members that are sitting on that particular working group. And we are very strategic in ensuring that each member represents a different sector. So ultimately, that central coordinating committee or the steering committee is all of acts as backbone support for the project as a whole. And then we have established that we need 5 action planning tables or working groups that ultimately help to support implementing various aspects of the action plan. So as of now, we have 2 working groups set up. We have one around libraries as community connectors, and then we have one around the development of a repository of services, as well as this particular table is charged with doing a gap analysis. So taking a look at all the services and supports that we have within our community and identify potential gaps and opportunities for addressing those gaps. And then as we move along in terms of implementing our project, we'll be able to form additional working groups to support other aspects of the plan. But as of now, we have a total of 20 different community partners involved in, from different sectors involved in those action planning tables. Okay, so I just wanted to provide a few highlights of some of the actions that we've taken to date. So we started to commence, so if you can recall, one idea that came out of our service provider survey was around branding and as well as around a repository of services and service agencies. So we're starting to work on both of those. So we're commencing work around naming, kind of a naming of naming of the system and naming of this project. Right now, we've just been calling it Keeping Kids Healthy Through Collective Impact, but we want to come up with a name and a logo that really is identified by our partners, and really, to have some ownership at our community level in terms of that. So this particular branding and logo will help to represent the project as a whole, as well as our overall vision of change. As well, we've already we developed and implemented consultations with our library staff to understand their needs to act effectively in their role as community connectors. So that is in the process right now, and then we'll be taking a look at all the information from those consultations to identify what are the needs of library staff to act more effectively in their role. Actually, tomorrow is when we commence some work around the development of a consultation guide and a process for family engagement to support our better understanding of what families need from libraries as community connectors. We've started to commence work around the development of a local repository of local services and service agencies. As well, as I mentioned, tomorrow we're going to start some work on developing a consultation guide and process for family and provider engagement to help us understand what are our service gaps and what are opportunities for addressing those gaps. So we anticipate, we've done, I would say, the last year has been a lot of community engagement, a lot of engaging our providers around what they see as issues and challenges within the system, the development of that common vision, the development of that co-created action plan, the forming of our working groups, and then commencing some of the implementation of some of those strategic priorities within the action plan. We anticipate 2020 is going to be full of a lot more action. So, like I mentioned, we're right now just finishing up our community connector capacity building consultations. So our next step is to develop a plan and implement that plan around capacity building in 2020. We will be commencing engagement with families around what they perceive as service gaps and the needs that they have, things that they need from community connectors. We will continue to work on cultivating this repository of local services and service agencies with the goal of launching a final product in 2020. We hope to bring all of our partners together again after we've had a few successes with the project. We really want to bring the larger coalition of agencies back to the table to launch our logo and our brand, and then communicate some of the successes that we've already achieved, as well as build further momentum in the project. We hope to garner support for our common vision by scheduling and attending various council meetings and other stakeholder meetings. And then lastly, we want to develop a shared measurement system and then look for ways for garnering support from partners and buying into this particular system. So there are a couple aspects of our action plan that we probably won't get to in 2020. We might commence some planning around, but ultimately 2021 we'll look at some more work around how the system can facilitate earlier diagnosis and referrals, as well as more work around what is equity, how do you apply an equity lens to programs and services. So we anticipate we'll probably have some professional development opportunities or training opportunities for service providers around what is equity and how to apply an equity lens. Okay, so I'm just going to end with the last bit of my presentation just around some of the lessons learned in our community to help propel some action in your community. All right. So the first lesson is the importance of fostering an environment for collective impact. So from the beginning, it's very important to consider potentially having a multi-sectorial kickoff event to launch a project, to ensure you consult with partners on key issues and solutions right from the beginning, and to involve partners in all aspects of data gathering and interpretation. The benefits that we've seen is that it's really, this really allows for meaningful participation of our partners in the process, and it really enriched a shared understanding of local issues and challenges. The second lesson would be around investing in collective visioning and action planning. So to look to involve partners in all aspects of the process, from developing the vision statement to developing the strategies for action. The benefits that we've seen for doing so, it again allows for meaningful participation in the process. Partners feel included and very vital to the effort. Partners buy into the actionable items and are invested into moving forward. And partners feel that they are taking action as part of a larger cause. The third lesson would be ensuring you have multi-sectorial representation. So at the start, when we were developing our various working groups and we developed our steering committee, we always asked, who are we missing? And then we followed up with those that were missing at the table, making calls, setting up meetings to discuss the project and the role that they can play. The benefits that we saw from doing this, it really helped to broaden our lens. You see the issues and solutions from all angles. And then when it comes to implementation, you can extend your reach when commencing implementation. In terms of implementation, it can really help to extend your reach. All right, this is a big thing for me. I don't like to meet for the sake of meeting. So I find it very important to have make meetings matter. So have a purpose. Another thing that I really try to do at all of our meetings is use engaging strategies to facilitate participation. The other thing that I really try to do is use meetings to get work done. Benefits: partners feel engaged and have a purposeful contribution, and they make it a priority to attend your meetings because, again, they feel that they are contributing, there's not a lot of boredom, and they feel very engaged. This lesson is around being a solid backbone structure. In order to lead a collective impact project, partners need someone who is very results-oriented. They need to be very collaborative, important to invest the time and energy into relationship building, need to be very focused, but also very adaptive. Share credit. Try not to take ownership, as this is about collaboration, and each partner brings to the table a different gift. Ongoing communication is very essential, and it's important to be reliable. If you say you're going to do something, follow through and do it. Benefits: helps build trust in the leadership, and partners will want to be engaged and stay engaged. And then the last lesson I just want to share is it is really vital to invest in skill building opportunities at the outset to have a toolbox of strategies to facilitate engagement and partnership development. So I'm just going to list some of the suggestions that I would have you consider and some of the things that I've invested into trying to build my skills in. One is around strategies for facilitating meaningful meetings. So you can avoid that meeting boredom and really ensure that partners feel engaged in the meetings and feel that they're participating in the project, as well as facilitation skills to support interpreting data, generating and prioritizing strategies, helping to reach consensus, and overall visioning exercises. And then as well, investing into a better understanding of community engagement strategies. There are a number of different levels of community engagement, as well as various tools for engagement. And then lastly, as system level thinking is very new for many of us, including myself. If you are embarking on this type of work, it is really important to have an understanding of what all this means. And I will be honest, in the beginning, we spun our wheels a bit, trying to understand what is system level thinking and system level strategies. It's when we came across that document that I mentioned earlier called the Water of System Change that we really had this aha moment and we felt we had more clarity around this type of work. So I'm just going to end with this slide that shows some links to various sources of information around collective impact, around system level change, community engagement, around how to make meetings work, as well as some facilitation techniques. And then I'll end there with questions.
That's great, Nadine. Thanks so much for a very thorough and excellent presentation. In keeping in spirit with one of your suggestions, I will take the opportunity to mention that ROI is so very privileged to be able to work with the caliber of folks on this project. They've done amazing work, and again, it's our interest in sharing this story more broadly, hoping that other communities will be able to garner some lessons learned from your work. So thank you sincerely, Nadine. One question I had, just to kick things off, and I would invite other folks to chime in with questions if they have them. But when you're looking at system level change, and you mentioned that you were trying to engage folks from the very beginning to build buy-in and to build meaningful engagement. If you look at a timeline on the project, were there any surprises in terms of how much effort or how long that takes investing in the community engagement process? And maybe any surprises that you had along the way?
Well, that's interesting because we had to work very, very quickly on this particular project, which I think could have pros and it could have cons. So our funders, the expectation is we started our work in November, and our situational assessment or our needs assessment was due to our funders in, I believe it was March. So we had to work very, very quickly on gathering up our data, understanding what data we had available, implement those caregiver interviews, implement that service provider survey. So we had to work extremely quickly. So the con of that, I would say, is we're still identifying that there's more information we need, which isn't necessarily a bad thing. I guess, for me, I think, okay, if we would have had more of this information up front, would it have shaped our actions differently? But at the same time, that's pretty, continuing to collect data along the way is very integral to the collective impact process. So, but the pro, I would say, is it moved us to action fast. So by having a short timeline, it really, it didn't drag things out. We really, invested into getting the information we need in a timely way. So I really think that helps for partners to feel more invested because there wasn't this big lull of time in the engagement process.
Yeah, that's interesting situation. I think a lot of communities, likely based on different funding timelines, will find themselves in similar situations. There's a question from the crowd from Ray Bowman. Do you have one or multiple indicators of success around this project? How will you know if it is a failure in 2 or 3 years, or if it has met the expectations?
Right. So our action plan, we have a number of different indicators. We have established, on that one slide, I only showed you the 5 strategic priorities and the strategies for action. Each one of those strategies, we've identified short-term and long-term outcomes. And each of those short-term and long-term outcomes, we are going to be measuring. So everything has been lined up. In fact, tomorrow, as I mentioned, we have a meeting and we're going to be looking more at those short-term and long-term outcomes and establishing a plan around when and how we're going to start to collect some of that information, as well as around shared measurement. So each one, I can share that back to the group that, like I mentioned, each one of them have various outcomes and indicators established with them. I don't know if that particular person wants me to read out some of them. I'd have to pull out my action plan, but yes, we've established aligned outcomes and indicators for each of those strategies.
Great, thank you.
I had a question going back, is something you mentioned around next steps, the idea of giving it a name and branding the work that you're doing. From my perspective, I think that's really important for communities to be able to immediately associate with what it is you're doing and to have a sense of that. So can you speak to the process and how you feel that's important to maintaining community engagement and interest in the project? Sure.
So we actually are just starting, as I mentioned, that process. So we have hired a fellow who has expertise in this area. So what we have actually done is we've provided him with our action plan. So he's now aware of what our common vision is, what are our strategies for action, what are we trying to achieve through these various outcomes. And then what he's going to do is come to our central coordinating committee and walk us through a process utilizing some of the information he's gathered and present some ideas back to our central coordinating committee. And as I mentioned, we have 7 partners that are sitting on that particular table. So we're going to do a lot of the work at that particular table on crafting some options around a naming and a logo. Then our intent is to take that back out to our community partners that are involved in those various working groups, as well as do a pilot testing with some families within our community as well. And then once we've finalized a final naming and a name and a logo, as I mentioned earlier, we're planning on doing a launch event sometime in the first half of 2020 to share that back to the larger community partners, as well as embedded in a larger communication plan.
Awesome. Diane and Tony, I see you're on the line as well, and I remember from last week you did have a well-defined brand and name for your project. Do you have anything that you might add to that and build on what Nadine spoke to? Diane?
I'm waiting for Tony to unmute there, but yes, I would just underline how important that is. It's something that one of our working groups took on right away, and we found it to be actually a great engagement exercise too, because they really got into it. It helped them to reflect a little bit about why this was important, to convey to the community that this was a collaborative effort. Anything else you want to say about that, Tony?
Yes, am I unmuted? Can you hear me?
Yeah.
Mm-hmm.
I'm sorry, can you hear me now?
Yep.
Okay, good. Yeah, I thought the exercise that we went through was similar to the one that Nadine's going to adopt, yes. And I thought it helped to bring the partners together. It sort of gelled the group into a collective rather than a collaborative. And I think that is useful, and it's also, of course, essential for communicating with the community through the media, through the social media, and through any contact that you have with clients. You're on the right track, Nadine. That's great. And the process you're adopting is absolutely great.
Yeah, and we're really looking forward to this next step, because I really think once we have that name and that logo, then I think we'll be able to really pull all of the pieces of the action plan together and really go back out to those that are still maybe like, what is this work about, and what are they trying to achieve? How does this all fit together? I think once we have that, I think it will provide a lot more clarity to those that aren't necessarily sitting at a working group table.
I agree.
Ryan, could I just ask a question verbally rather than through the chat?
Absolutely, yeah, go ahead.
Sure. Nadine, I was really interested in the work that you're doing, putting together a repository of resources and I wondered if at this point, do you have any vision of what the end product might be or what you might want it to be? Thinking about a brochure or a handbook or some kind of an online resource? Are you at that point yet that you've thought about it?
Yes, yes. Yeah, that's work actually, interesting enough, the repository was a 2020 project. However, so right now there is a repository that is available as of current called familyinfo.ca, which is currently an online repository of services and service agencies within London and Middlesex. The problem right now, though, is there's a lack of awareness of that particular repository, as well as when we consulted with our service providers, they would say that it falls short in really representing Middlesex and really representing the services and sports within Middlesex County, that is very largely focused on the City of London. So we had to move this particular project forward because the City of London is embarking on an update to this particular familyinfo.ca. So they recognize that there is a lack of awareness, that it's outdated, and that you know, that there needs some change to happen within that particular repository. So we have aligned this particular project with that happening in the City of London. And so we've actually had some great successes in this, in that we have been able to add a few of our partners from some of our working groups as part of this collective impact project. We've advocated to have them on the steering committee in the City of London. So why that's successful is we're increasing representation from Middlesex County within the updating of this particular repository. So that is a big step for us, that we're really helping to increase our voice, Middlesex County's voice at that particular table, and being able to express what we need from this particular repository. So it will be online. It is being developed at the City of London level, but like I mentioned, with representation or input from Middlesex County. And so that particular repository cultivates information from Southwest Healthline. So it pulls the information that we need or we're interested in having from that particular larger repository of services.
Thank you. That helps, because we're at that point as well. We have a number in the area of food security. We do have guides and lists of resources, and we're really trying to figure out how best to make that available to the community, and how will it get used, and how will people be aware it's there.
Mm-hmm.
Yeah, and so oh, sorry. Go ahead.
Oh, no, yeah, that particular repository, yeah, we want it online so that it can be continuously updated. So if you have a paper resource, I mean, that can very quickly become outdated. Yeah. We've also identified that we need to do some work with Southwest Healthline in terms of some of the services and supports that we have available in the county aren't necessarily being represented in the Southwest Healthline. So our repository, the familyinfo.ca, is only as good as the information at Southwest Healthline. So this has been an interesting learning for us, is that we need to do some work at both levels. And then, as I mentioned, everything's going to be all connected. So this logo and the branding is really, for lack of a better word, because we have to go through this branding process, I always call it like Middlesex connected. This whole project, it's this vision I have, it's like Middlesex connected. That's not what it'll end up being. We'll go through that process, but that repository is part of that connected system. Those community connectors that I mentioned, the libraries and community connectors, they're part of this system. Once we have this repository developed, getting it to where we need it to be, then we'll be having to do some training with our community connectors to help them understand this repository, how to use that repository. and then do communication out to our service providers and our families around all of this, how to access the repository. If you're still struggling, who can you go to for information and support? Well, you can go to your Middlesex County Library as key community connectors. So, you know, all of these, there's lots of action happening, and eventually it will all piece together as part of this connected system.
Thanks. Little bit of a follow-up question. I am fascinated with how you talk about the library as being a community connector. In Prince Edward County, of course, we've been very aware of that, and we've utilized them in that way. But what I'm fascinated with is that you talked about intentionally giving them support so that they can carry out that role as community connector. And I think that's something in Prince Edward County we can really think about. It's been a little bit one way. We've brought resources to them and said, please make the community aware of this. But and they're part of a couple of the collectives that we have going in Prince Edward County. But to think about actually providing them with support and resources so they can be that, that's taking it to the next level, and I really appreciate that you talked about that. You mentioned training as one thing, but I'm thinking even there may be some other, maybe some financial resources or something else that allows them to do what we're expecting them to do, which is a pretty big community connector job.
Mm-hmm.
So
Yeah.
Thanks for that.
Yeah, and as an aside to that, like through the process of our provider and our service provider and our interviews with caregivers, as I mentioned, that libraries were identified as the key connector. I also want to recognize that there were other connectors or other agencies that were identified as connectors. So you have your child cares, you have your schools. So there are other connectors within the system. So we recognize that. And so the first step is to establish, ensure that our key connectors have the capacity to work very effectively in their role. Another aspect of this particular project as a whole is then to reach out to those other connectors within the system. So whether it's school secretaries or childcare providers or whoever else is also connectors within the system, to look at ways how we can build their capacity. So ultimately, the highest degree of capacity building is going to be with our key connectors, because we want them to have it all, right? Have all of the information and supports and capacity, like build their capacity to the fullest. And then we want to go out to those other levels of connectors to ensure that they have what they need. And, you know, and then if they feel they can't connect or they don't know where to access information, they can go back to the libraries as key connectors. So it's kind of, again, you know, we recognize there's all kinds of different pieces of this particular project, but I don't want to lose touch with the fact that there are other connectors within the system and that we want to work with them as well.
That's great. Really interesting back and forth there. So thanks, Diane and Nadine. I think we're getting close to the end. If there's any other questions, I would invite people to chime in or to add it in the text box. But just one other question from my end, Nadine. Are there any unexpected outcomes that were sort of a pleasant surprise or an unforeseen challenge that you were forced to deal with that kind of didn't fall within your planning process, and how did you deal with those?
Sure. I think the most interesting and challenging part of the work was that visioning part. And I remember, like, back in the beginning, we were just that, like I said, that kind of spinning of wheels, really trying to understand system level thinking and what are we doing here? Like, what is our vision and what is the purpose of this project? And I remember, like, a lot of partners feeling like a bit frustrated and unclear. But then once because they were involved in this whole process of gathering the data, interpreting the data, all together in the same room over the series of these various meetings, when we actually sat down and we put it back out to we had a helpful in terms of facilitating this. When we had 4 different working groups set up at one meeting, and we said, okay, now with all of this information you've heard, go and develop what you see as our vision statement, or what is our common vision. When we brought those 4 groups back together, it was unbelievable how similar the vision statements were. So here we had 4 different working groups, frustrated with this whole process, go to their separate tables, come up with a vision statement, and then come back. And when we looked at them, the commonalities was so impressive. So it was just, then all of a sudden everybody was like, wow, you know, as daunting as that process was, it was just so valuable as well. That really helped people to feel that they, yeah, like it's like a shared and collective vision statement, as this whole collective impact process is supposed to be about.
Yeah, thanks, Nadine. That's really interesting to see that kind of emerging from the group. And I'd like to take this time to thank you for your thoughtful, detailed presentation and insightful responses to questions. I see Tony is giving you a round of applause on the line as well. So thanks very much for doing this. We're very encouraged to see this kind of work happening out there, and again, we hope that some other folks will be able to learn from some of your experiences as well, and maybe adopt some new ideas into their own work. So as I mentioned before, we are going to be posting this online, and in case anyone has any other questions, feel free to reach out to me by email, and I can try and connect you with anything you might need. Just a quick note that on November 7th, which is coming up in just 2 days, we will be having our final webinar in this series, looking at combating social isolation. We'll have Gary Mahan from Chigamik Community Health Center, and they'll be talking about some of the work that's been done with the North Community Health Link around looking at social connectedness and the impact on the health of patients and the amount of use of emergency room visits and things like that. So it's going to be a really interesting exploration of how community engagement can contribute to better health outcomes, but also to reductions in healthcare spending. So very much looking forward to that. I'd like to thank everyone on the line. Thanks to the folks who are asking really great questions, and this was a really informative session. So thanks to everyone, and I hope you have a great day.
Thank you, Ryan.
Thanks, Nadine.
Thank you.